Hello, everyone. Thank you so much for joining us for this Arrive Together webinar today. It's great to have all of you here. We were really thrilled by the level of interest and the number of questions that we received today, and we're looking forward to getting started. So just to introduce myself, my name is Matt Camarda. I am the Advocacy and Public Policy Director for National Alliance on Mental Illness in New Jersey, or NAMI New Jersey. Really pleased to be here with you today, and thank you again for joining us. I am really happy to introduce our guest speaker for today's presentation. Her name is Tiffany Wilson. She serves as Senior Counsel and Director of the Office of Alternative and Community Responses. She joins from the Union County Prosecutor's Office, where she spent over 2 decades as an Assistant Prosecutor, handling a wide variety of criminal litigation. Most recently, she supervised all matters related to criminal justice reform for the Prosecutor's Office. For the last decade, she also supervised all of Union County's diversionary programs, with a particular emphasis on mental health diversion and programs related to the interception of mental health and the criminal justice system. Tiffany received her BA from Villanova University and her JD from William & Mary Law School. So I'm looking forward to having Tiffany present for us. I had mentioned earlier that we had received quite a few questions as part of the registration process for all of you. And so throughout her presentation and then afterwards, she's going to do her best to try and answer as many of them as she can. Obviously, the number of questions that we received exceeded the amount of time that we have with her. So please be understanding. But again, we thank Tiffany for joining us today, and I will now cede the floor to her to start her presentation. Thank you so much, Tiffany.
Thanks, Matt. And thank you everyone for joining us. I am a big fan of NAMI New Jersey, and I have partnered with NAMI Union County for years. So happy to be here and speak to all of you. So I'm going to dive right in because I know our time is short. Obviously, today's topic is New Jersey's Arrive Together program. And Arrive stands for Alternative Responses to Reduce Instances of Violence and Escalation. Obviously, a handful and a mouthful. So we affectionately refer to it as Arrive or Arrive Together. And really, the impetus for Arrive began in 2020 when our Office of Public Integrity and Accountability was reviewing body-worn cameras. Here in New Jersey, we have a mandate that all law enforcement officers wear body-worn cameras. I believe we were the first in the state to mandate that statewide. And in review of those cameras, particularly as it related to law enforcement use of force and fatalities in law enforcement custody, what they recognized was, or what they saw was that 2 out of every 3 uses of force by law enforcement involved a civilian suffering from mental health or substance use issues, and that more than half of all fatal police encounters occurred in a similar circumstance. That team in OPIA approached the Attorney General at the time and said, this doesn't seem right. And is there something we can do about it? And what they developed was the first pilot of Arrive Together. So hopefully, if I've done this right, I'm going to play a video and hopefully it will have sound. If for some reason it doesn't have sound, I promise you it's just music in the background. So you're not missing much. So that video was made for our 2-year anniversary, excuse me, which was last December. So just a little bit about how we got here, because now we are approaching our 3-year anniversary. So as you saw from the video, in 2021, in consultation with DHS and Department of Human Services and community stakeholders, the Office of the Attorney General and the state police piloted the first Arrive initiative. And it was a pretty simple concept. It paired state troopers with a trained crisis intervention specialist and someone who was, the officer was crisis intervention and de-escalation trained through the Crisis Intervention Team Training Program, or CIT. And they were paired with a certified mental health screener and crisis specialist to respond to 911 calls involving behavioral health incidences. So it put the two of them in an unmarked car together, and officer in soft uniform, along with the mental health specialist. Now, for those of you who don't know, the Office of the Attorney General and the Department of Law and Public Safety have several offices and divisions fall under the Attorney General's purview in the Department of Law and Public Safety. One of those is the New Jersey State Police. So for us, and getting the law enforcement partner to partner was a relatively easy prospect, because the Attorney General was in charge of the New Jersey State Police. So the real question became, we knew that the pilot worked. We knew that it was doing well in Cumberland County, but could it work if we were utilizing municipal law enforcement agencies? And while the Attorney General has directive authority over local prosecutors' offices and local municipal police departments, he does not, in fact, control them. And so we really needed to see, would be able to get buy-in from municipal departments. And so they chose Elizabeth and Linden in Union County. And as Matt mentioned before, that's where I come from. So we were there for the very beginnings of the first pilot in Union County. But Linden and Union County, really progressive chiefs, particularly concerned with mental health and the mental health of their community. A good chunk of their officers were crisis intervention team trained. And so we knew that we had great partners in those chiefs and in those communities. And it turned out that we were right. Following that particular model, so that was July. So we launched in December of 2021. In July, or the summer of 2022, Linden and Elizabeth joined in Union County. And then by the following December, we had our first telehealth model. So the first models were co-response. That's what we call it. It's law enforcement and mental health provider in a car together, unmarked car, soft uniform for a law enforcement officer. Atlantic City wanted to try a model that involved telehealth, that connected the officer to a mental health professional via an iPad, which would go directly to the emergency mental health care and connect the officer, and then the individual via iPad to either de-escalate the situation, to do an initial assessment, and then to determine next steps for that particular individual. So that was now the end of our first year. Somewhere in there, Roselle Park arrived together also in Union County. So really 4 municipalities in the first year joined Arrive. And for us, that was a great success, getting the buy-in from both mental health partners and law enforcement. But what came next was, what would this look like if we were to expand this across the state? What are the things that we would need to do? And so after speaking with stakeholders, what we knew, or what we discovered in some ways, and what we knew, were that each municipality, each county in the state had different resources. They had different resources, they had different supports. Many of them had really innovative programs that were happening in different pockets throughout the state. We didn't want to take over those programs. We wanted to be able to partner with them. We wanted them to tell us in their community what their needs were and what resources they had that could support providing law enforcement with a mental health resource to respond to cases. And that's really all that Arrive was. It wasn't to create another mental health program. This was a partnership with, and is a partnership with, DHS. We use existing DHS resources to provide the mental health service and to fund the mental health portion of the program. Law enforcement receives no funding for this. They don't get any overtime pay. They get no funding. What they get is a mental health resource to respond to the multitude of times that they get called to a situation where it turns out that the issue is really mental health related and not criminally related, or that it's just more appropriately handled by providing someone with mental health services, even if there was a criminal component. So, in speaking with our partners around the state in many locations, what we found and what we had found from the original pilots was that follow up, making sure that someone who got connected with mental health, a mental health provider and mental health services, that somebody was checking in to make sure that they were continuing along that path, that they had the things that they needed, that they didn't have additional needs. And so, in many locations, while they were doing a great job in connecting individuals to original mental health services, where they were seeing a lack, it was in follow up. And so our follow up models really were developed because of conversations with our mental health community, our community partners, and our law enforcement officers, as well as, again, the DHS partners, about what was really needed in a particular community, understanding what resources they already had available to them. And so the next step was our follow-up model. And so in some locations, that's in our follow-up locations, what happens is a law enforcement officer who interacts with an individual but recognizes that they would benefit from mental health resources contacts their trusted mental health partner, their Arrive partner, and that partner agrees that within a set amount of time, they will follow up with that individual. And maybe that's once, and maybe that's multiple times, depending on the need of that individual. And in general, that follow-up occurs without law enforcement at all. So with the follow-up model, that got us to the summer of 2023. And so around that time, I think you saw from the video, we were in about 36 municipalities around the state. And so that is about the time that I came from Union County to the state, and the conversation with the Attorney General was, will you come to the state and help us to make Arrive available throughout the state? And so we really had to decide, like, how was that going to happen? What was the need? How are we going to do that? And while we had the generosity of the governor and the legislature, we did get a $10 million allocation. But when you divide that by over 9 million people in the state and in 21 counties and 550 some municipalities, that money does not go very far. So we had to be efficient and effective with how we were using that money to provide law enforcement and the community with the much needed mental health resource and getting it to individuals at the time that they needed it. And so we're a really diverse state. So what we realized was that in a really rural community, having a law enforcement officer paired with a mental health professional, because of distance that needed to be traveled, was not always the most effective or efficient way to get a mental health professional on scene with a law enforcement officer quickly. And so what was developed from that was our close in time follow-up model. So that model sort of plays off the idea of our co-response program, but understands that having, with a small department in a rural area, having a police officer only dedicated to being with the Arrive partner when the number of calls that they might get would be so minimal was not very efficient. So in those models, the mental health provider meets the law enforcement officer on location. Normally, in less than an hour, most times it's probably 15 minutes. Sometimes it's almost immediately, but it frees the officer up to continue to do their other duties. And it also, for our screening centers in those more rural areas, it also allows that mental health provider to provide additional support to the screening center or the mental health agency that they work for. So using those models, using that input, what we have been able to do is to provide a mental health resource to law enforcement in all 21 of New Jersey's counties. And that was within that 2-year period. And I just want to highlight that for a minute, because on its own, having a program like this that's available in all 21 counties in 2 years would be really amazing. But what we really did was we did it in a 6-month period, because that first 6 months, we were only in 3 municipalities in 2 counties. I'm sorry, we were probably in 7 municipalities in 2 counties. By the end of 2023 or 2022, by the middle of 2022, we were in 36 municipalities and in, I think, 8 counties. By the end of last year, we were in all 21 counties, and we continue to grow. So today Arrive is available to over 55% of the citizens in the state of New Jersey. We're available in all 21 counties. We have 3 counties that Arrive is available countywide, and we are in over half of the municipalities in the state. New Jersey is the first state in the country to have a statewide law enforcement and mental health alternative response program. And the program, and we believe the success of the program, is because it acknowledges and leverages the existing resources for efficiency. It builds trust, and then we bring the most appropriate expert and then allow them to utilize their expertise. So when a law enforcement officer and a mental health provider respond together, whether it's a close and tight time follow-up or a co-response, or obviously in the follow-up model where there is no law enforcement, once it is determined that the situation is safe, the officer steps back and lets the mental health provider take the lead in that interaction. They determine how they're going to interact with this individual, and they make obviously the final decisions related to mental health. But the other benefit that we learn from our mental health partners is that oftentimes there are individuals who have had an experience with the mental health system. And so their lack of trust is actually not with law enforcement, but it is with the mental health provider. And so our mental health providers also tell us that having the alternative of having a mental health or a law enforcement officer who is in plain clothes, who is trained and who is empathetic and who has received specific training beyond the training that they receive in the police academy or in mandatory trainings throughout the state, but extra training as an alternative to building a rapport is actually really valuable to our mental health partners as well, when the individual really doesn't trust the mental health system, but is okay with speaking to law enforcement. So the outcomes that we are seeing with Arrive, it's leading to safer outcomes for our most vulnerable residents. We're having mental health specialists rather than an officer address the behavioral health concerns. And we know that that is keeping residents safe. And it's also just leading to less frustration for officers. What our officers were telling us is they're going to these locations, they are seeing what the issue is, but they didn't have the resource to be able to help. And then involvement of an Arrive team leads to fewer arrests, fewer uses of force, fewer injuries, and it eliminates racial disparities with respect to the outcome. Arrive is increasing the utilization of mental health resources. Traditionally, an officer interacting with an individual in crisis had really only 2 options. One was call the screener and then wait. And in some locations, so I'm from Union County, and as great as the screening service is in Union County, if you have to get from one side of the county to the other, and depending on the amount of staff available, sometimes that wait was over 2 hours. And in that time, what was maybe a situation that wasn't escalated then did escalate. In addition, it's consistent. So they would either wait for a screener, or consistent with the law enforcement officer would make the decision to transport the individual to the hospital involuntarily. And what's not on this slide is the other tool that law enforcement has, which would be arrest. And nobody wanted that to happen. We don't want to arrest people for an illness. But when an officer believes that that's the only alternative to ensure that someone gets the help that they so desperately need, that became a possibility. And we wanted to avoid that choice even being in the mix. Arrive keeps residents in the community. What we know from our friends at DHS is that only about 1/3 of individuals in crisis who are transported to the ER actually require hospitalization. There are so many reasons why this isn't a great idea. And I know that I'm preaching to the choir with the people on this call. We know that that's stigmatizing. We know that we already have a shortage of mental health resources and a shortage within our screening centers. So to tie up our screening centers with individuals who can be appropriately treated in the community, it is not good for anyone. And I could go on and on about the reasons why we want to decrease the number of people inappropriately transported to the hospital. And I say that when I say inappropriately, I mean because they don't need to be there, not because the decision to send them there was inappropriate. But if we can avoid that situation, it helps everyone, especially including the person that law enforcement is interacting with. It's clinicians that determine when someone should be evaluated for hospitalization and when that individual is able to remain in the community, particularly when connected to services that meet their needs. We know that by law enforcement can make that decision in certain situations, but when we have a clinician on scene, they can really interact with that individual, determine what resources they already have available to them, and can make a more informed decision. Arrive is improving trust between law enforcement and the community. Arrive is a community-informed design, and it's designed to fit the specific needs and resources of each community. People ask me all the time, well, why don't you just mandate Arrive everywhere? If we mandated Arrive everywhere, we would break the mental health system. We needed to find a solution that incorporated what we knew already existed within the mental health system, partnered with them, and made that more efficient and available to law enforcement and to individuals who were interacting with law enforcement. We know that law enforcement is often the first to see the need, and we wanted to give them that resource early in that interaction. Arrive also improves the health and well-being of individuals with mental and behavioral health emergencies by connecting them with care and resources rather than the criminal justice system. If the only tool that we give law enforcement is the criminal justice system, they're going to use that tool because it's the only option they have. Arrive provides another option. I'm just going to show you really quick the Arrive Together webpage, hopefully, if I can make this work. Here we go. So this is our Arrive Together webpage. You can obviously read through it yourself, but I wanted to highlight a couple of things on the page. First, I'm going to go straight to the bottom of the page. And if you go to the bottom of the page, you will see this lovely map of New Jersey. On my phone, it's actually my screensaver. But if you clicked on any county within this interactive map, we'll look at Hunterdon County. So Hunterdon County is a co-response model. Hunterdon Health is their model, their partner, and these are the towns that are covered in Hunterdon County. So you can do this for any county. One of the questions I think that came through was, when will it be available in Middlesex County? As you can see, as you saw from the video, and as you can see here, it is available in Middlesex County, and it is continuing to expand. And in fact, we have some additional towns literally on the brink of joining in Middlesex County. So I just want to acknowledge that I did see that question, and I wanted to make sure you had that answer. There's other information on here, but the other great thing about this is if you click on this little thing right here that says Arrive Data Dashboard, we launched our Arrive Data Dashboard. So if you click on it, you can actually see how we're doing. So as of September 30th, this will get updated either tomorrow or the next day. I'm almost positive it will be tomorrow. We had 5,034 Arrive interactions already in the state. And then you can see some other things related to the types of models, some of the demographics. You can see what the original call came in as. So you'll see a referral from So referral from a mental health provider follow-up, 911, requests from law enforcement. We see a large number of our Arrive referrals come from law enforcement officers who are on location and realize that this is an interaction that is better served by having an Arrive team there rather than a traditional law enforcement only team. And then also some of the reported behaviors. So and this is just observed behaviors. We do not ask officers to diagnose. So these are just what they got called for. So some of them will be a welfare check, for instance. So now one of the questions also was related to a call that came in as a mental health check. I will say that when a call comes through the 911 system, and that's what Arrive responds to, calls coming through the 911 system, and the request is for a welfare check, even if that has some form of mental health component, the first responder is always going to be law enforcement, because the first priority is always going to be safety. And it's also going to be in response time. So law enforcement can obviously respond in a much quicker time than a mental health partner or even like our 988 teams and M courts, and I'll talk a little bit about that in the questions, can respond to that location. And in that situation, we are definitely talking about safety. So I just want to highlight a couple of other things, and then I'm going to hopefully get to some of the questions, the great questions that you all asked. But I want you to know, not only is Arrive a great program, but it has led to some really great results and some changes in the way that we're doing things at the Department of Law and Public Safety and the Office of the Attorney General. So my office, the Office of Alternative and Community Responses, was really originally formed to make Arrive statewide. That was the original goal. But in my very first conversations with Attorney General Plotkin, we had a conversation about, what does this look like? I came from Union County, where I focused a lot on mental health and mental health diversion. And what I knew from my job there was that we were siloing how we respond. Like, people became the mental health assistant prosecutor, or the substance use disorder assistant prosecutor, or the diversionary assistant prosecutor, or you were just an assistant prosecutor and you didn't have to know all of these things because somebody else in your office was doing this. And I knew that when we siloed that work, we were not getting the best results for the citizens that we were serving. And so when we formally created the Office of Alternative and Community Responses, the Attorney General, by directive, placed several other things within our purview to make sure that they were all working together and coordinated and better serving the citizens of the state of New Jersey. So we do work in opioid prevention. So we have an opioid prevention response bureau. We also do our resiliency bureau. So ensuring that our law enforcement officers have the help and support that they need to do their jobs and to live their lives in a healthy way, particularly as it relates to their mental health. We also think that Arrive and programs like Arrive are aiding to the resiliency of our law enforcement officers by reducing the frustration that they receive, by giving them the tools that they need to do their jobs better, that in particular being a mental health or substance use disorder partner that can help them better interact with the community that they serve. Our law enforcement-led alternative policy and programming bureau, that's where all of the work sits, where we give law enforcement those tools and aid them in responding differently to interactions that are better handled in the public health sphere. And then our diversionary policy bureau. So even our diversionary work in this state was, or in the Attorney General's office, was divided all over the place. And diversionary work was happening. It's happening all over the state. And so we wanted to give municipalities, communities, prosecutors' offices, a one-stop shop of places that they can go to get the support that they need, and that we can help drive the policy that helps create some of these programs. So OACR sits at the intersection between public health and public safety. The work being done across LPS, whether it's diversionary programs, resiliency, opioid work, including our use of our opioid settlement funds, and what used to be NJ Cares. And then also the directive recognizes the existence of that siloed work being done in that space, and leading towards a solution. So the things that we were looking at, we knew that the mental health, substance and substance use crisis existed. We knew that the opioid crisis was in its third decade, and that suicide accounts for the majority of gun deaths in New Jersey, or sorry, in the United States, which is important because the other thing that our office does, or will soon be doing, is we will be leading the Department of Law and Public Safety's work as it relates to extreme risk protective orders, or ERPOs. And so, and we know that oftentimes those cases are coming through as mental health cases, rightly or wrongly. And so we want to make sure that we are handling those consistently around the state. And we are seeing a staggering increase in stress and depression and isolation and loneliness and accompanying mental health hurdles faced by Americans of all ages. And it is law enforcement who is responding to those first. More than half the people in jails have been diagnosed with a mental health condition. More than a third of the prison population has been diagnosed with a mental health condition. And people who suffer from mental illness are more likely to be injured during police encounters. None of that is okay. And so we are trying to change that tide. We know that the majority of people with serious mental illness are not violent. But there is a strong association between mental health disorders and increased risk of suicide, and suicide accounts for more than half of the U.S. firearm-related fatalities. So I hope that you're seeing why we thought that it was important that all of those things fell under one office, one place where we've got eyes on all of it, that we can develop overarching policies that can impact all of that and address all of these issues. And we know that there's a high rate of recidivism with the individuals who have a substance use disorder, who are involved in the criminal justice system. Same is true with mental health related diagnoses. And individuals who would benefit from treatment are unlikely to receive that within the criminal justice system. And if you remember from the earlier slide I mentioned, but sometimes law enforcement was getting frustrated because they believed it was the only tool they had. So you have the people who control who goes into the criminal justice system believing it's the only option they have, but we know that the outcome doesn't play that out in real time. And the demands on law enforcement and those in the criminal justice system has been untenable. Officers, attorneys, court staff, judges have been asked to become experts in mental health and substance use disorder. They're expected to be the equivalent of a social worker or a physician. And we know that familiarity in all of those spaces is essential, but to ask them to be experts doesn't serve anybody well. And that people who suffer from mental illness are more likely to be injured in a police encounter. That's how we got to arrive. And we know that people who are in the criminal justice system who have a substance use disorder or mental health diagnosis are more likely to remain in the system, which is why diversion falls under the Office of Alternative and Community Responses. We know that we cannot rely on traditional criminal justice responses to reduce or alleviate these harms. We know that it requires innovative approaches, and we know that Arrive Together is one of those approaches. So we're really excited about Arrive Together, but we're really excited about the path that Arrive Together has taken us as a state to really go back and look at the way that we address all of these issues and figure out how we can do it better. And so not only is Arrive a great program, but it has really led the way in change and innovation in how law enforcement responds to issues that really are best handled by a public health response. I just want to highlight one other thing, and then I'm going to get to your questions. So, and I think this is important for all of you to know. I know many of you are community leaders, or who maybe are a part of a mental health related agency. In 2020, the Attorney General's office issued one of our law enforcement directives. Remember, I said that the Attorney General has directive power over prosecutors' offices as well as police departments. And that directive created a statewide framework for addressing mental health and special needs populations, particularly those that touch law enforcement, but really it was to bring everybody to the table and help address the issue collaboratively within each community. The directive established working groups in each of the 21 counties to review policies, programs, and protocols to maximize their county's response to those with disabilities or those in a mental health crisis. And this includes substance use disorders as well. There is a corresponding statewide working group that oversees this work and oversees this work as it relates to the state as a whole. And so that is a great resource and a great place to tap into to find out what is going on in your community. Many of those working groups were part of the creation of Arrive. They were seeing this, and they were seeing that this might be a viable solution, but they were also the impetus for several other really great programs that are happening throughout the state. Somebody had mentioned in their questions the On Point program that's out of Ocean County. That's doing really great work, and it's actually partnered with Arrive. And one of the things that Arrive has been able to make happen is that great programs like On Point that were really that their ability to expand was limited by grant funding or limited funding coming from the county or specific municipalities, and which is a really slow process. And what Arrive has been able to do is to uplift the work that On Point is doing and help them to expand. And so they have become, really the backbone of Ocean County's Arrive program, because we've helped them expand in a much quicker way than their plans had ever anticipated. So we're really proud of the fact that we can really uplift and help these really great programs expand under the brand that is the Arrive Together program here in the state of New Jersey. So with that, I'm going to answer a couple of questions, unless Matt, there's anything that you needed before I got started.
No, I think you can go ahead and start answering questions. I think that was a phenomenal presentation. I look forward to hearing some of the answers. I think you kind of maybe addressed a few of them throughout, but I'm definitely looking forward to hearing some more questions and answers. So thank you so much.
Yeah, no problem. Okay, so here we go. So the first question was, what policies enabled this program to be created, implemented, and succeed? So the interesting thing is we actually started Arrive with no policies. It was really just, we would like to give you a resource. Are you willing to accept it? And we have found that in not mandating Arrive, we have gotten more buy-in than we have in almost, I have been doing this work for 25 years. We've had more buy-in with Arrive than any other program that I have seen in this state. And it's because we went and said, we want to help you, tell us how to help you, but also understood that if we gave them, or if we gave communities a cookie cutter program, that was never going to work. We do not live in a cookie cutter state, and the resources that are available in Sussex County are different than the resources available in Camden County, and the communities are just different in how they interact with each other. So by working with communities and with law enforcement agencies and with mental health providers in each of those locations, we were able to work with them to develop a program that worked without all of the baggage that mandating required. Also, again, I think I mentioned before, if we mandated this program, we would break the mental health system. We'd have police agencies that just can't do this on their own. And so in many of our locations, police agencies join with each other to provide them the Arrive resource to their communities, because they are partnering with each other to deal with the staffing issues that they have to deal with, because again, they don't get money. So I believe that it was in the collaboration and the coming in and saying, we want to provide you with this resource, help us figure out how to do that, that actually is what's making it succeed. How do I activate Arrive for my loved one? So I am going to read this because I think we get this question, a similar question later. I'm reading this question as, how do I make the Arrive team come to my house? So Arrive comes through the 911 system. So a call comes into 911. If the dispatcher has enough information in most of our locations, if the dispatcher has enough information to recognize that Arrive would be an appropriate response, the dispatcher can directly, in most of our locations, can directly dispatch the Arrive car or the Arrive team. In most of those situations, there is an accompanying patrol officer who is responsible for arriving, no pun intended, with that team to make sure that the entire situation is safe. That officer will then leave when that's determined, and the Arrive team will stay. While you can mention the Arrive team, you cannot directly dispatch that. That is a responsibility of the dispatcher or a law enforcement officer who has already been called to a scene. And most times we know that the dispatcher actually doesn't have enough information from the caller coming in to determine that the situation is going to be safe enough to introduce a social worker in particular to that situation. So it's often the officer on scene that recognizes that, and they will directly call for the Arrive team. But safety is our number one priority. We know that we have a shortage of mental health professionals in this state. What we don't want to do is to deter them from participating in this program by putting them in a situation that might be unsafe for them or for the person that they're trying to provide help for. So we always want to make sure that safety is first. So you cannot directly make an Arrive team come, but you can definitely, if you are aware of it, insert that idea into the dispatcher's head so that the dispatcher can ask you follow-up questions, because we know that in a time of anxiety, the person on the other end of the phone actually doesn't provide enough information for the dispatcher to be able to make that decision. We had a lot of questions about training. So the training of the law enforcement officer is part of the agreements related to arrive. At the very least, if they are co-responding, the law enforcement officer must have had or is in the process of having crisis intervention team training or CIT training or the equivalent. That program is a 40-hour certified program. Every law enforcement officer in the state of New Jersey receives mental health de-escalation training, mental health training and mental health de-escalation training, as well as de-escalation training in the academy. If they, everyone has to go through the academy, they must receive that specific training. And every law enforcement officer, I believe it's every 4 years, has to have training specifically around mental health and special needs and the interaction between law enforcement and those communities or individuals who are experiencing signs and symptoms of impacted by or that are related to mental health and substance use disorder. How has Arrive helped with the training? So what we found from our Arrive teams, and this is both our mental health provider and our law enforcement officers, they have told us that actually participating in Arrive has actually become the best training that they've ever had. Their close partnership with each other has helped them to learn from each other, to learn different skills, but just to better understand why things happen the way they do, to question those and to come up with new policies and protocols when appropriate. So every one of them has told us that it's the best training that they've ever received, that hands-on training with each other. Interaction with other existing programs or MCORTs. All right, so as I mentioned before, the intention of Arrive was never to overtake any program that exists, or any program really that DOH or DHS is putting forth. MCORTs is a big one. For those of you who don't know, I think most of you probably do, but MCORTs is the sort of response arm for our 988 system here in New Jersey, and hopefully about to roll out any second now. We're really excited about that. So MCORTs is a response to a call that comes through 988. So the call comes through 988. It's determined that that person on the other end of the phone would benefit from somebody being physically with them rather than the really great talk work that 988 and those call lines have been doing for years, even before there was a 988. And MCORTs, will respond when they believe it is appropriate for that call that comes through the 988 system. At some point, there might be communications back and forth and dispatching back and forth between Arrive and MCORTs. That functionality doesn't exist yet, but we are in constant conversation with our friends at DHS, quite frankly, also our friends at DOH. And so we are monitoring that work. We are partnering together, and many of the MCORTs partners are also Arrive partners. All of them are talking to each other, and through those mental health special needs working groups, we are directly encouraging specific communities to have these conversations about how best to use these systems, but more importantly, how we can make sure that people know that if you don't need a law enforcement response, 988 is a viable and great option for you. All of that being said, we are working with our partners to really make sure that when you make a call, whether it's to 988 or it's to 911, that there isn't a wrong option. The only wrong option is to not ask for the help. Make the call. The person on the other end of the line will determine whether or not, based on what you've shared, if you're calling 988, whether or not a law enforcement response is necessary. And they can contact 911 to make that happen. From the Arrive's perspective, if the call comes into 911 and they dispatch a patrol officer, that officer on scene can make the determination that this is more appropriately handled by a team that involves a mental health provider. We have to assume that the call came to 911 for a reason. We know that's not true, but we have to make the assumption. But hopefully, as MCORTs get up and running, that communication, even to maybe dispatch an MCORTs team, will hopefully also be an option. So they're all working together. to figure that out so that the person who's calling for help doesn't have to. When will it be active in my county? We are in all 21 counties, so whatever county this is, it is active in your county. I can't promise you that it is active in your municipality, but hopefully coming soon, because our goal is the entirety of the state. And how do I get arrive in my town or department? So if you are a non-law enforcement person asking this question, how do I get arrive to my town? I would strongly suggest that you reach out to your municipal department and tell them that you want to learn more about how arrive can come to your town, because quite frankly, it might already be in the planning stage. If this question is coming from a law enforcement agency, contact your county prosecutor's office. We have partnered with them to help us. We cannot, we are a mighty team of 3 right now in OACR, though hiring as we speak. And so we have really partnered with our prosecutors' offices to help us to get arrive into every town. So if this question came from a municipal police department, contact your prosecutor's office first, and they can help you with that. Will arrive together counselors help crisis negotiations and stay at barricades until the scene is clear? I'm so glad you asked this question. So just recently, the Attorney General amended our use of force policy here in the state of New Jersey. It will require, as of January 6th of this year, that all of our crisis negotiation teams or our tactical teams, so what most people think of as hostage negotiations or SWAT, those teams must have a partnership with a mental health professional when they respond to barricaded subjects or hostage situations. So come January 6th, that will be the mandate in the state. And we have made, through the Arrive Together program and the Arrive Together allocation from the state, we have made funds available to those teams to partner with those mental health professionals. Many of them will be utilizing the relationships they've built during the Arrive Together program, so they already have a trusted partner there, and they're, as we speak, building those relationships. And that is, again, it is an addition to, or it is an amendment to our current use of force policy here in the state of New Jersey. Where can you find more information? I just showed you that website, so that's exactly where you can go. Data on outcomes for co-response or close in time follow-up. Some of that data can be found on the dashboard, so you can go and look at that. I can tell you that as it relates to outcomes, we are not currently seeing a difference in outcomes. We are seeing success in all of our models, and that might change in the future. And you can keep an eye on that dashboard. But we are seeing success in all of it. And we think that's really because the locations picked a model, and some of them are building models on top of models, but they picked the model that their community most needed at the time. Are there volunteer opportunities for this program? Unfortunately, there are not in the way that I think this question is being asked. So the mental health partner is a DHS contracted agency. So that agency may have some opportunities, but the Arrive Together program does not. But I say that, but I do think that you can reach out to your prosecutor's office and say, how can I help? And they might be able to put you to work. So definitely, I don't want to discourage anybody for doing that, but there are no formal volunteer opportunities. I think the next question's a little bit similar. What role will New Jersey peer specialists workforce have in the Arrive Together program? That depends on the mental health partner that is participating in Arrive. So again, if the agency that does Arrive in your community doesn't yet use a peer specialist, definitely reach out to them and find out if there's space for that in the programs that they do. Arrive didn't create a mental health program or mental health resource, so we're reliant on the resources that already exist. Is this only for adults? Great question. So it was intended only for adults, but for the most part, our Arrive teams will respond to you say the pediatric population. I come from a criminal justice world, so it's juvenile population. But for the under 18 or the under 26 population, they will respond to those cases. They won't ever say no. But it just is a matter of what those follow-up services look like. almost every single one of our Arrive agencies have recognized this need, and they are partnering with or finding partners in their communities that they can help to make referrals for this particular population. What kind of situations do the social workers respond to? Would a social worker respond to a DV call? So this is on a case by case basis, but I think I mentioned before that one of our primary goals is to ensure that everybody in the situation is safe. So obviously DV calls have an extra layer of concern for law enforcement, individuals involved, and introducing somebody else into that situation. So the officer is always going to err on the side of safety in that situation. But do we have a blanket no in that situation? We don't. We trust that the partners know each other, and trust that they're going to keep each other safe. So could there be a situation in a DV call where maybe the team decides it is an appropriate situation for them to be there, but we will never force that situation. Safety is always our priority. So I think I got through most of the questions that you all asked. I don't know if I haven't been paying attention to the chat, if there any more showed up in there, but I do want to just take this time to thank all of you for your interest in Arrive, for the great work that you all do. And I look forward to seeing you or hearing about maybe some of you interacting with your mental health special needs working groups in your counties or with some of our Arrive partners. And we always appreciate the great partnership that we have with NAMI. I know all of our county prosecutors' offices feel that way. And here at the state, NAMI in particular has been an amazing partner. And in my career, NAMI has been an amazing partner. And I'm so thrilled that I could share this really great program with you. And quite frankly, much of what we do at OACR and the work of Arrive really comes from input that we have received from NAMI, or probably many of the people on this call.
Thank you so much, Tiffany. Your presentation was so thorough, and I really appreciate you gun through those questions. I didn't know how many we were going to get through, but you really kind of consolidated and combined them really well. So that was really informative. And I just wanted to say to the people who are on, I hope that, one thing that you take away from all of this is just that there is so much, good and important work going on in the Attorney General's office, and also in so many of your counties and your municipalities who are working with the Attorney General's office to try and make this, program as effective as possible. They really are trying to make it so that a mental health crisis does receive a mental health response. Thank you so much to everyone for joining us today. Thank you to Tiffany. And I think that we can end. I'm just thrilled at how this has gone, and I'm very happy that all of you could be here to see it. So thank you, everybody, and I wish you all a great day.
Thanks, Matt.
All right. Bye-bye.